Hello everyone, today we're going to be doing a simple dressing change and wound care. So the first thing you're going to want to do is check the doctor's orders. You're going to want to check the nursing notes to see if the incision was well approximated, want to touch if there was any redness, what kind of exudate was coming out of the incision, the sutures, and is it well approximated, right?
Yep.
Okay, so before you enter the patient's room, you're going to want to go and do your 2-minute hand hygiene. When you re-enter the room, you're going to want to introduce yourself with your designation. You're going to want to get the patient to confirm their name and date of birth. You're going to check the wristband and confirm the information. You're also going to want to ask for any allergies, if there are any pain, discomfort, if they need to use the washroom, and if this is a good time to do the wound care and change the dressing. All right. So after that, the patient is all fine. You're going to go and grab all your supplies. So right now, we have our supplies here. So you have a CNS swab, you have a sterile dressing tray. You're going to want to make sure that the bag is not ripped or torn. You're going to want to ensure that there's no discoloration. You're going to want to check the expiry date. And any abnormalities, you won't be able to use it. So we have saline here, we have tape, we have sanitary wipes, and we're pretending that this is hand sanitizer, and 2 sets of gloves. All right, so you're going to want to raise the bed to working height.
That I will need for this are 2 pairs of gloves. I will need some tape, a dressing tray.
Put the bed rail down because we won't work over it. And in real life cases, we would be facing the patient rather than facing this way, just to ensure that we would never turn our back to our patient. The garbage we have right now is in this position, but usually it's right down by your feet. It's just here because of the size. But this is just a better view to show you what we are doing. All right, so the first thing I'm going to want to do is put hand sanitizer on, ensure my hands are nice and clean. We're going to put gloves on. All right, just tell the patient what you are doing, so you're going in to take the bandage off now. Some patients might be uneasy seeing their wound, so best practice is to peel away so the patient can't see their wound. So you're going to want to support the skin when peeling off. So just gently, just to maintain that skin integrity and not cause any pain or discomfort for the patient, right? You're going to want to roll it a little bit under just to ensure that the patient does not see what is on the bandages. Right. And just ensuring that you maintain that skin integrity, supporting the skin. All right, now it's off. Okay, so at this point you can examine the bandage for what kind of exudate it is, any severe bleeding or anything, and then always make sure you discard of the bandage above waist level, so like that. Perfect. All right, so now we are going to assess the incision. So you're going to want to look if it's well approximated. You're going to palpate for any nodules, any bumps. You're going to want to see if it's warm to touch. If there's any pain, it could be causing more pain than before while touching for the patient, so that can be a concern. You're going to want to look at the exudate, what kind of exudate it is. And what do you want me to do?
Ready.
We did this.
Yeah.
We can cut that off.
Yeah, so
And
you
then
can even
after-
cut out what we're saying right now.
Hmm?
You can even cut out what we're saying right
Okay.
now. So,
Perfect. All right, I'm taking off my gloves now. And discarding above waist level. I'm going to do hand hygiene. Now I've discarded my gloves, I've cleaned my hands, and I've cleaned the surface so I can open our sterile dressing tray. So what you're going to want to do is tear it at the bottom. You'll see that there's a little cut, easy to pull off. So you just pull this out and discard. You'll see that there's also a little piece of paper that will show all the contents involved, as well as your expiration date, and that as said before. All right. So you're going to want to face this towards you where the first flap is going to go away from you. So making sure that you're only grabbing within that 1 inch border. Each flap at a time. As you see, it unfolds very smoothly. And underneath here, you will see there are sterile tongs. I'm going to go in and grab those. And we're going to grab this flap at the sterile tongs because it is touching the tray, so we are unable to touch it with our bare hands. Sometimes it's hard to grab.
If there's any odor, the type of dressing is typically 4x4 sauce.
Yeah, drop it.
Okay.
Ready.
All right, now that we have it open, I'm just going to maneuver it so it's easier to access for myself, ensuring that we're using our sterile tongs to grab anything within the sterile field that's within like the 1 inch border. All right, so we're going to grab this and put to the side. This is also our garbage that we are going to discard of our swabs that we use to clean the incision. So I'm going to grab some of these. These are what we use to clean. I'm just going to organize everything just to make it nice and accessible for when we are cleaning the wound. Alright. Now this is the garbage bag. When you're setting down your tongs, make sure that the sterile side is within the sterile limits. Alright. Now for this garbage bag, this is going to dispose of our dirty swabs. So sometimes we can put this in and on the bed and between their legs. You can put it wherever feels comfortable or what the patient is comfortable with as well.
Okay, go.
Can I just start now? Yeah. I will apply gloves and I'm going to put this in.
I'm going to place this underneath the patient's leg. Usually I would ask my patient to lift up their leg, but then in this case, I'm going to lift up their leg.
Just in case they fall. Okay.
I got it.
I got my container ready with the long leg.
Only touching the 1 inch border.
I got my tray ready with the normal thing.
Leg there.
And just for reference, anytime I get wet.
So I'm gonna move my tongs.
Yeah, I was just wondering. I can open it.
Now I'm gonna grab my saline. Ensure that it is upside down because inside is sterile. I'm gonna grip with my hand, making sure that the label is on my palm. Right. So I'm gonna pour some and lip it so that the outside of the saline is now sterile. Alright, so now what you're going to want to do, you're not going to want to hold it too, you're not going to want it to touch the sterile field, but you're not going to want to hold it too high, and that way it could create some splashes, and we don't want that. So just above, just enough that you'll be able to soak it in cleaning time. So now that I have that and I'm ready, I'm going to grab the swabs first. Now making sure that you grab the lips at the top. And you're going to pull apart, ensuring that you do not touch the inside. You're going to pull upside down so that it falls onto the sterile field and discard. Perfect. All right. So now we're going to do hand sanitizer. And we're going to put on our clean gloves. Alright, now that we have our clean gloves on, we can start and touch the sterile tongs. Alright, so we're going to dip one pad in here, move it over, or just going to fold it up so it's easier to grab.
So what's the last thing?
Grab my other tongue and we're going to squeeze. So drain all that excess fluid out of the gauze. Perfect. Alright. You're going to want to ensure that the side you are cleaning with is a nice flat surface like this. Alright, so it's important to know how to clean the incision. So you're going to want to start from top to bottom, directly in the middle of the incision, working downwards in one streak. And discard. Alright, to grab another. You're going to repeat this as many times as needed to get rid of the, discard of that old exudate that was on the wound. Just folding in halves to make one little ball, easier to grab on, and wring out all that excess fluid. Perfect. Alright. And same thing again, directly from top to bottom in the middle of the incision, and discard. Alright, now let's say the exudate is all gone and we're ready to clean around the wound.
So I think right here is pretty healthy. It's breaking
Alright. So same thing before, fold up into a nice little ball.
And then we're going to put it in here. We're not going to try to touch the side. We're just going to put it in.
Grab nice and tight. All right. So we're going to want to do distal to proximal. So just like before, from top to bottom, distally, and discard. And again, more gauze in our solution. Alright, and then proximal. Perfect. And discard. Perfect. And now the wound.
Never really. Okay, so ready? Ready. Okay. Hi, I'm Stephanie. I'm going to be the student practical nurse. I'll be student number 2. We checked the doctor's orders, and there is an order for a CNS swab, which is a culture and sensitivity swab of the inside of the wound. So I'm going to do that today. I'll perform my hand hygiene, and I'll put my clean gloves on. Oh, gosh. All right, so what we're swabbing for today is we're swabbing the exudate just because it looks a little bit red in color, and they just want to make sure that that the wound is healing properly. So the types of exudate there is serous, which is clear to yellow in color. It's contains plasma, and that's kind of what you want to see for the process of healing. And we have serosanguinous, which is clear to, it's like pinkish reddish. It's a mix of plasma and blood. You don't really want to see that, but then we also have sanguinous, which is fresh blood, which is not what you want to see in a wound. It's okay if the wound is fresh, but you don't want to see that during the healing process. And then also we have purulent, which is tan yellow, thick brown. It's got a strong odor, and that are great signs of infection. So I'm going to take the forceps, quickly dry off the wound, making sure that everything is fine, making sure that I'm keeping them sterile. So you just want to go down in one swipe movement. You don't want to pat it dry. And then I'll do center, which is the cleanest, and then distal to proximal.
Serious, which is like the clear fluid, and then clear, and then there's serosanguinous, which is like the light pink, and then there's sanguinous, which is like the bright red, which means like fresh from the gun, and then there's also
Are you feeling any pain?
which is like
Feeling okay? Great.
green.
So I'll take these, keeping them on the 1-inch border so that the inside of them are still sterile. And I'll take my swabs. So I have it here. We would have our patient's name, the date, the time that it was taken, the test, and we would have it sent off to the lab right away. Keeping my hands above waist, I would drop it in the trash can. And then I would take the swab, making sure that I start in the center and roll the way down this incision. I would take it, making sure that I'm not contaminating the sides. Put it right in there, sign it, and send it away. And we'll wait for the results to come back. But it's important to know that if they had any ointment on, that we would make sure that it was cleaned off, and then we wouldn't do that swab for a few hours. So now I'm just gonna grab sterile tongs, and I'm going to grab the dressing, which is sterile. I'll take it, and we'll put it right over the incision, and we'll just let it fall, because we don't want to move it around, contaminating it. And by this point I can take my gloves off, but I'm not going to, because they're clean. And I would get some tape, making sure that I'm taping it horizontally so that it can bend with the joint, so that it's not ripping off the incision or ripping off the dressing. Sorry. There we go.
Do my hand hygiene, and now I'm just gonna label my samples. So I'm just gonna make sure there's a lab label on
There you go. I'll put that back. I'll take my gloves off.
the time and date, the kind of sample, what
I'll discard of them.
as well as my signature.
And then I will make sure that when I am discarding everything, that I take
There to make sure I send it off to
these and put them in the sharps. I'll put this in here.
feeling okay, not pain or anything.
And I'll put everything in here. Can I get you to lift that leg? You need some help? Great, thank you. I'll take this. There we go. Put everything in here, and we will discard of this tray into the garbage bag.
I would just make sure that I'm gonna pallet
And I'll take it and discard of this right in the trash.
that was red and did
I'll cover my patient back up.
and then I would do an after on what we did. So
There we go. are you feeling any pain? Are you feeling much better? Did you need to go to the washroom at all? Have anything to eat? You're okay? Great. So then I would put my bed rail back up and I would lower the bed.
And then I'm just gonna lower it again and make sure I hit them with this collarbone.
Right at the end. Right at the end.
There we go. I'd make sure that they have
From our 20-minute video.
this out.
Like literally right at the end.
There we go. I'd make sure that they have their call bell in reach. I would turn off the lights. Perform my hand hygiene again, because I'm done. Make sure that this gets sent to the lab. Take these and put them in the sharps. So I just discarded of everything in the sharps and I sent my specimen off to the lab, so we'll just wait on those results. So I just wanted to make sure that they were comfortable. They have their call bell near their belt, or their bed is lowered, their light is off, and they know that they can reach me if they need anything. Okay, so since we found on the incision that the area around the incision was red and it was a little bit warm to touch, and there was a little bit of exudate, we wanted to make sure that we documented our findings in our FDARP and made sure that we reported that to the cover nurse, as well as the culture and sensitivity swab. We would make sure that we documented both of those in here, and the swab is already sent off to the lab, but we would also report that to our cover nurse.